Swayam Prabha. Digital India. Educated India.
Good morning. Welcome back. So I wanted to do two things today. Want to go back, and we've been here now 3 days, looking at a lot of information. Sometimes, too much information. It's better always to categorize. So I want to just make sure what we have done so far and conclude one of the presentations that I did not. I was looking at my notes and I said, okay, on day 1, session 2, we were not finishing up one particular presentation. So I'm going to go through that on the research in supply chain management in healthcare. And then the second part today, I'm going to talk about healthcare analytics, which is a very critical topic. And I'm going to explain to you or appeal to you that if you look at healthcare, not just healthcare supply chain, but healthcare, the analytics happens at 3 levels. At the macro level, which could be a national type of issues. At the meso level, meso, which is more at hospital systems level. And at micro, which could be individual patient level. So how do you kind of look at analytics at these 3 levels? For healthcare as a whole, healthcare supply chain in general, and healthcare supply chain for India in specific. That's what we want to kind of categorize. So this is an important thing as you are going to present on Friday your thoughts and your thing that Professor talked about. Today's presentation is going to give you a lot of food for thought as to what you want to think about, because you will fit into one of those categories on doing something. Health economists will look at meso. People who are looking at disease control will look at macro. People who are worried more about hospital level or patient level metrics will look at the micro. So in this room, whoever is involved with healthcare will fit into one of those 3 categories. So that's what we want to do. Okay. So let me start off today morning by talking about, so far I have given you 2 types of framework. Yesterday we gave the framework on uncertainty in demand versus uncertain supply, and the strategies around it. Today, on Monday, we actually started off looking at this particular matrix, which is the supply chain resilience, because supply chains are subject to continuous disturbances, whatever they are, short-term, long-term. So how do you make supply chains more robust, more resilient is the question. So this particular matrix talks about, just to bring back and, to memory, 2 kinds of things. One is organizational commitment. Is your organization committed to looking at resilience as a very important topic and preparing the organization for it? More the commitment side of things. Not only when a crisis happens, right? Everybody, when the crisis happened, we all jumped and we all did things to help. The second part of that is sometimes it's not just the feeling or the commitment. You need to spend money. It could be training, it could be information systems, whatever it is. So what kind of spending happens towards building the resilience? That's the second part. So 2 by 2 here. On the upward trajectory, you could see high organizational spending. At the bottom, it is low organizational spending. To the left, you would see low organizational commitment. To the right, you would see high organizational commitment. So within that, you get those 4 quadrants. So we'll start with each of the quadrants. The most ideal quadrant is quadrant 1, where you have both, which is high organizational commitment as well as high organizational spending on resilience. So what would be the characteristics of that particular quadrant? You would see building supply chain resilience is not a one-time event or a one-time project. It's a long-term kind of a commitment, not one individual project. High spending is mostly on the digital investments. because in healthcare supply chain in specific, you are talking about availability of products, which means inventory, which means tracking and tracing the products that are flowing through the system. So digital assets are very critical to manage this kind of information. So high spending on digital investment to drive supply chain operational excellence, and then both short-term and long-term focus on addressing immediate supply chain concerns and building a competitive advantage. So supply chain is not a cost center. Yesterday we kept telling that. Only when you make it a competitive advantage would supply chain really provide you with the benefits that you're looking for. As long as you look at it as a cost center, the driver would be, how can I reduce cost by doing something short-term? Beat up a supplier for discount. Beat up a logistics service provider to provide something faster at the same rate. Things like that in the short term might work, but long term you would not get their cooperation, or they may go under because of constant cost pressures. So the thing such in the resilient zone is the long-term focus also, not just the short-term focus. So let me stop there because we want to understand this matrix thoroughly. Any question on zone 1, the resilient zone, which is the most ideal zone? Okay, I'll keep going. If there's a question that comes up, just raise your hand, please. We'll address that. Let's just go counterclockwise for the time being. So number 2 is what we call as not the most efficient zone, the inefficient zone, where you're still spending. So the spending is happening, but the commitment is not there. Sometimes, the IT systems will keep updated. The IT systems need to keep up with whatever the vendors are giving. So the spending might continue to increase. However, is that properly utilized depends on the organizational commitment towards building the resiliency. So here the characteristics is building supply chain resiliency is done through only individual projects. Okay, there's a project to improve, say, forecast accuracy. That's all. Nothing else happens. That could be short term on a particular product, but not as a methodology for the entire organization to think about forecasting. Not using the technology into which they have invested connected to that goal of improving forecasting. So that is what example I gave you about the wiggly giggly, right? So immediately now the next year they would say, be careful not to use the data. That's all to it. It's only the wiggly giggly data that's not used in the future. The attitude towards some event has happened that has triggered a forecasting error, and how do I deal with it is an organizational commitment error. That doesn't happen. Just investing in digital assets can give you some efficiencies, but not all that you're looking at. That's why we are talking about number 2 as an inefficient zone in spite of investing in digital assets. Let me stop there. So we finished 2 zones. Any thoughts, questions you had? I'm going to take my time with the zones. Okay, now I'm going to jump to number 3, not in that anti-clockwise, but just jumping to 3, which is the organizational commitment is there. Now, people have understood post-COVID, your boss is telling, you're being trained on resilience type of things as an organization, but spending towards digital assets in general is not keeping up. You still are dependent on some old legacy systems. You're not able to track and trace well what's moving through a system. There are errors like what we saw with, what's his name? I forget, Ishan. The first day we saw the character who thought there was 2 weeks of inventory where it was not there. I'm sure Ishan's area is committed to resilience, but they are not spending probably to update software. So that's what we call as point solution. So individual solutions happen, but they are not connected together. So building supply chain resiliency is viewed as an ongoing process, not an individual project. So the commitment is there. Spending constraints limit supply chain improvements to niche, not enterprise level solutions. Solutions are not connected. They're just happening at one particular point in time. And then short and long-term focus on addressing immediate concerns and potentially building some competitive advantage. So these are all good things as goals, but unless there is some investment to support, it may not completely come out like a resilient zone. So this is point zone. By increasing a little bit of investment and being smart, you can easily go towards the resilient zone. Let me finish up with the fourth one, which is more like a reactive zone, where you're talking about both being low. Organizational commitment is also low. At the same time, spending is also low. So that's why you are continuously reactive. Things happen and you try to see what can the organization do, which many of us do in our organizations. There's not a single organization that's not having a reactive zone at some point in time. But does the organization always have only reactive zone as is what we are talking about from a resiliency standpoint. So building supply chain resiliency and maturing supply chain capabilities are not priorities. Focus on other aspects of business operations are the priority. Low spending on supply chain given the relatively low priority, and only focused on immediate supply chain problems. So that's kind of the nature of this zone. So again, a reactive zone can easily come into a point zone by at least increasing the organizational commitment and people that through training and development, like attending these kind of things, at least would make you think, how do I move towards a commitment? And then hopefully in the long term, if there is an investment towards smarter digital assets, that then moves you to the zone one, which is the resilience. Okay? So stopping here. Any questions, thoughts? Okay, let me move. So healthcare organizations, because of COVID, went through financial turbulence. In many parts of the world, surgeries and things were stopped, right? So paying customers did not even do elective surgeries. Other than emergency, nothing happened. So definitely during the COVID period, there was a dip financially. The dip has come back today, but definitely it slowed down that growth that has happened. So healthcare supply chain, because it supports what the hospitals want, since the hospitals did not, think about patients for a while because patients are not coming, surgeries are rescheduled, the supply chain investments were also slowed down. So today, I was looking at data. Globally, supply chain investment, if you look at it, is close to a $2.4 billion annual dollar investment, supply chain solutions, of which in India, the investment is around 90 million. Okay, so given the type of complexities here and these people issues, the investment is slightly lower. However, by 2032, annual investments are predicted to be at about 230 million per year. So there are some ways of, but you got to be smart in that investment. So, healthcare supply chain management, by now we have been talking about this a lot, but what are the major issues if you are to look at? And this is something you may want to reflect on Friday when you come back. From your perspective, from the Indian perspective, how does this play out in what you know about healthcare supply chain? So number one is demand forecasting and inventory management. Again, We are not talking about healthcare. We are talking about healthcare supply chain. So be careful. Sometimes people think, oh, this is not disease control. That's not what we are talking about. We are talking about healthcare supply chain to support the operations of healthcare. What's the number one thing that happens is demand forecasting and inventory management. Because demand forecasting is not a very uniform kind of things because of the categories of products that are used, right? So some is going to be functional products, some is going to be behaving like when a flu season happens, the same vaccine behaves more like a fashion product. Everybody wants it. Responsiveness is the number one metric. How can you be responsive if you don't have enough inventory of vaccines? When the flu season goes away, then at that time, the same vaccine availability is not that important. So if somebody is forecasting for vaccines in the non-flu season type of things, then its forecasting is very different than when you get into the flu season. So the same product behaves differently based on the seasonality, which is what complicates, because if you put one forecasting system there and automate it to forecast without paying attention to seasonality and bringing in more sophisticated data based on the seasonal variables, there may be other factors. There may be more vulnerable population and things of that kind. I mean, it was interesting. I read another report that said dividing India into north, west as one category, south as one category, east as one category. North and west, you see more technology investments into large hospital systems that take more risky patients, the aims of the world. And so they are experimenting a lot. They're investing into these things. Go to the east, more government-led, large-scale investments for the government. And so that's a different type. South, more to do with digital technologies a lot more, and medical tourism. So just look at, that's a macro level analysis, not a meso or a micro. Just that you go back and look at this, you would see investments into that. But that's not the final word, right? So every hospital needs its own when it comes to the micro. But macro sometimes tells you where investments are going. So demand forecasting is one. Cost containment and budget constraint. Always, healthcare is not abundantly with a lot of budgets. So that's always a constraint. It's a constrained optimization, as they call it. Caps on what you can spend. So that's an issue always. Supply chain disruption and uncertainty. So that has become more after COVID. That part of the supply chain can actually shut down. So if it shuts down, what are you doing with? What are your alternatives? That whole, what if scenarios kind of a thing. Supplier reliability and relationship management. Because this is not an area where many people can just say, let me start something in the healthcare supply chain because of the regulations, because it will be approved by the government, because of the caps on what you can get paid. So this is an area that is why, large corporations come in when you talk about medicine or pharma or even equipments, diagnostic equipments, surgical equipments. There are not too many players here. That itself stifles to some extent competition. We're getting into more in the delivery side. The startups are happening a lot. The digital side, we're seeing a lot of startups and entrepreneurship. But otherwise, if you look at healthcare, it's pretty static in some ways in the large players and things of that kind. So the supplier relationship and reliability is always tenuous. Because the power, what do you say in the supply chain? Supply chain, who has the power? In a retail supply chain, you can think about the one you and I interact every day. Today, if you're going through Amazon, that has the power. The suppliers have to match what they want. healthcare supply chain, hospitals you think will have the power, if there are some private hospitals, maybe, but equipment manufacturers can have a power. They are giving you the next generation of diagnostics. So the power in the supply chain plays a lot in terms of how the reliability and relationship management happens. So that's I think that probably. Data visibility and integration. Healthcare is the last place where heavy-duty investments happen. It's slow. It's deliberate. As we said, so many different variables, government-led versus private-led versus all those kind of things. So data visibility and integration, Dr. Sundar the other day talked about walking into an Atlanta hospital and seeing a dashboard of who's going to be the next patient. And that leads a lot of investment, trust in the data to display it there. Remember, a lot of airlines now get flags when they say ahead of time that the aircraft is delayed. You and I get upset. They're now trying to get us up-to-date information as to when the next thing will happen, but customers get upset when you give more information versus you don't give more information. So all those type of things, data visibility and integration is an issue in supply chain also, healthcare supply chain. Regulatory compliance, I don't think any other industry has as much as healthcare because it's dealing with patient safety. Patient safety. I don't remember how many things I had to sign before I went into the surgery. I read some of them. Hopefully they didn't ask me to sign after they put the anesthesia into me. But compliance is so. And then once the pacemaker was put in, there were 7 different people who came and talked to me. From the manufacturer, which is Medtronic, all the way to the nurse on different things. And everyone after talking had to take my signature. So the compliance aspect of healthcare is onerous, which has its impact on how do you source, what do you do in a supply chain standpoint. Logistics and transportation challenges. Because it's not that well consolidated. Professor, I think, talked about risk pooling. If things are more fragmented, the pooling becomes difficult. Government to some extent can do that, but you had talked about how the unavailability to 3rd or 4th tier kind of community hospitals and things of that kind. So this thing about logistics and transportation challenges are tremendous. Last mile is so difficult when you're looking at more rural hospitals and availability. Professor talked about drones and delivery. So all those challenges have to continuously be addressed. And of course, post-pandemic, we have learned a few things. We've made some course corrections, but we are also become very skeptical on a few things. So all those are what we see as the unveiling major issues of healthcare supply chain management. I'm going to stop here again, please. Well, we always say, even for the humanitarian supply chain, which applies to healthcare supply chain to a large extent, is what do you do in the peacetime? Peacetime is no disturbance has happened. How do you position inventory? Where do you position inventory? It is the funding of those inventories that always is a struggle with humanitarian supply chain. Some organizations like Red Cross have a robust funding. So during the peacetime, say they know that a flooding is going to happen, annually in some part of the world, and they have to evacuate people. So they have to do X, Y, and Z to keep people safe. So they need to position some of the inventory blankets, whatever it is. They may have to build a warehouse closer to a more safe region. So all those are not decisions you make after the flood has come in. It's a peacetime decision. Now, has those decisions been implemented? Has the inventory been blocked? That's the interesting, struggle people have on the financing side of things. Supply chain in healthcare is very similar in that situation. It is the positioning of the inventory. Here the deal is who positions. Is it the distributor that's going to be responsible for positioning the inventory, or is it the hospital systems? So those type of discussions happen a lot in the healthcare side. So similarities are there in forecasting, but there are some very big differences also. Humanitarian is looking at only events and planning around the events that happen. In humanitarian supply chain, one of the critical areas of research and what has happened is donor base. How much do you depend on governmental support versus the NGOs that depend on foundational support? So if you look at data, it clearly says 2 to 1. 2 times the investment into anything comes from donor base compared to government. That's the reality. Now that reality might play out differently in different parts of the world because when things happened in Sri Lanka a few years ago on tsunami and things, the government said, I'm not accepting goods from outside because it created a chaos. So they said, we will manage it internally through our investments. But those things are rare. Mostly you see 2 to 1 kind of investment. So that has a big impact on some of the things that you're talking.
Yes, absolutely.
Absolutely. I don't want to mix those two. They are complementary. At the time that humanitarian episodes happen, health becomes a more critical one, blood donations and things like that. So the healthcare jumps in and uses its muscle and power to help. But then the wellness part that you're talking about, some extent the healthcare steps back and other NGOs and others step in to help in those type of things. So both have, it's only complementary. I don't think it's adversary to each other. Okay, keep moving. So next couple of slides, I want to talk to you about some issues and risks in healthcare based on what we saw in the previous slide, kind of expand on the previous slide that you saw. So one is this inconsistent demand. What do we mean by that? I already talked about flu season and things like that. So seasonal variations and unpredicted emergencies cause inconsistent demand for specific materials and medicine. Right? So when you look at other industries, an automotive industry, you could create artificial demand through incentives. But more or less, how many cars or how many vehicles or how many motorcycles can people buy is not going to be like that. It's going to be pretty consistent. It's not inconsistent. Whereas that is what might happen because of the reasons that are, seasonal variations versus unpredicted emergencies. More than 90% of healthcare providers reported that the COVID-19 outbreak has disrupted their supply chains. Obviously, it's not something that people have used to or planned for it. What are the risks when you have something like inconsistent demand? Obviously, it's all inventory related. Stockouts and materials and medicine scarcity could happen, or overstocking. So it could be you forecasted a flu season and the flu season was relatively mild, so you didn't have to go through the extreme treatment procedures other than vaccinating people. So overstocking could have happened of the things that you predicted. So higher costs are caused by these kind of demand fluctuations because you may have to expedite some material to come in, which could come by costlier transportation options than what you would have otherwise used. You might have brought in smaller lots as opposed to larger lots where you could have gotten a better discount on that product. So all these things increases the cost to satisfy the demand. So that's one. Second is lack of visibility is another issue we said about healthcare, which is mostly because how do parties collaborate? If people are competing and not collaborating, then sharing is going to be always difficult. And so transparency also becomes difficult. So parties cannot track movement of items. It makes the process of planning more challenging. I talked about CPFR, collaborative planning, forecasting, and replenishment. If both Procter and Gamble and Walmart did not agree to do this and collaborate, the rest of the things are not going to happen. They knew that in a product whose demand is pretty consistent, having fluctuating inventories is an expensive thing. It's not helping either Walmart nor Procter and Gamble. There is the need to reduce that inventory. We talked about, people who are joining us late, we talked about shampoos. Consumption of shampoo is not like this. It's pretty consistent across the globe. So why would you have inventory that fluctuates like that? So that's what Walmart and Procter and Gamble said. How do we manage this so that our inventories are what the market wants, right? Even the other study that Procter and Gamble did was on diapers. So they looked at orders placed in a supply chain. Okay, one end of the supply chain is your consumer, the babies that need diapers. Again, babies are pretty consistent. If you are using the diapers, they're not going to need 10 one day and 0 the next day. So their fluctuation is not that way, to give an extreme example. So whatever Walmart or whoever is selling those diapers, wherever it is, they know the consistency of the demand, they see it. But then when you looked at the order placed from a distributor, Walmart to the distributor to a manufacturer, it started fluctuating more because people started speculating. Price fluctuation, forecasting error, inaccuracy, all these adds up. And so that's called the bullwhip, right? So the bullwhip effect that happens in a supply chain. And so inconsistent demand, lack of visibility creates that bullwhip, always. So anything you could do to address those two issues reduces the need for carrying unwanted inventory. Quality control is the same way, because if you're not proper, then you're carrying extra only to meet the quality needs, not the needs of the customer. I get 5 syringes I buy from this supplier. I know 3 will be good, 2 will be bad. Then you're going to speculate how much should I buy from that supplier rather than solving that quality problem.
When hospitals make procurements, they make part supply, part payment basis depending on the quantity that they have ordered. So when a batch lot or a particular comes to the institute hospital, how much sample size is recommended to check it, to accept it? Is there any formula? Or sometimes they just walk into the store, randomly pick 2 or 3 items, and sometimes the supplier himself shows the best ones for checking because they do not have so much time. So is there any formula to...
I can talk about this the entire day. Is there a formula? Yes. Statistical quality control is an area by itself. It all starts with what is the average outgoing quality level that you want. So that is a measure for each of the items. It's not the same for this item versus this item. The functionalities of these two are so different that I cannot use the same sampling for this that I can use for this. So that's the starting point. But what is the tolerance towards quality is what we start off with. If your tolerance is very, very low in terms of defects, that then translates to more sampling, which is more expensive. But statistical quality control is an established field and gives the guidelines for doing it. Now, implementing such a thing is based on manpower expenses. So, we have science that says how to do this. Implementing a science is a different option, which is where we, in the slide before, I talked about resiliency and commitment of the organization. That's a commitment. The organization is not committed to that. Then the spending will not happen. Then you would never get into that resilient zone. Nothing is wrong being in the other zone, but you're going to be reacting. And long term, the expenses would probably pile up to be the same level had you invested and done it at first stage. So one is inconsistent demand, the other one is insufficient demand forecasting. That is always coming short on your forecast because you have not considered all the variables. In predicting demand, I'll do a large number of factors to consider. Our healthcare has that, right? So population size and age and risk factors, and male versus female, mix in the population and whatnot, age groups, all that has issues. And think about non-communicable diseases. If you think about what is the number one macro challenge in the world, non-communicable diseases, which includes diabetes and heart-related. Those are two major ones. And that varies. If you talk about demand forecasting, it varies so much with age, population risk, dietary habits. So it's not just saying somebody is doing a wrong forecasting. It's so many variables are involved. Sometimes it becomes difficult to be accurate. So that leads, from a supply chain standpoint, always to mismanaged inventory, which could either be overstocking or shortage. One of the two can happen. Cold chain management, another big issue in supply chain for healthcare. Maintenance of medical products that require specific conditions like temperature, humidity, etc. So what are the risks? Compromised quality of medical products. So either they are completely useless, you cannot use them, or their efficacy drops and you have to use more of them to get the same results, which increases your cost. So you're thinking of one vial of injection to a patient, now you have to give two, and that increases your costs. So that's the cold storage. New technology adoption, anything that can give you real-time kind of data, which is going to have increased costs to it. And so, but the risks are also there, data breaches, any cybersecurity type of issues. So those have to be managed. Supplier reliance, we talked about that. Regulatory compliance, we've talked about it. So these are the issues that happens now. This diagram talks about at various levels of healthcare supply chain, manufacturer of raw material, pharmaceutical, medical device, biotechnology and vaccines, and clinical. All these different levels, the risks and issues that we saw in the previous slides play out differently, right? Why do they play out? Let's look at a pharmaceutical as an example. The number of products that are growing. Pharmas today make money by introducing different versions and advanced. So the products that you and I have to manage from a pharma perspective is far more. Suddenly the sales agent goes in and tells to the doctor to prescribe something that they have to convince. It's peak demands. Demand peaks. And by the time that data is available for a supply chain person to put it in and order, that train has left the station. More inventory has to happen. So we are always reacting to some of these things because of the complexity, and one such complexity is growing products, stock keeping unit level. So we know the stakeholders in healthcare, right? The people that are providing, the patients like us, the payers, could be government, could be yourself, insurance, the supply chain, which is the vendors, pharma and manufacturers, and all the research organizations that support. So these are the stakeholders. What are the major issues if you think of it from a stakeholder perspective? We looked at all the issue perspective, but if you are a stakeholder who falls into one of these categories, what are your major issues? If you are a provider, the electronic medical record becomes the number one way of collecting data today of a patient. And the electronic health records is major investment. Again, it is not cheap. And it's not investing just in it. How do you integrate it across? So if the health record is available only at one point in a hospital system and not shared across with other points, then that has its own implications. The data becomes fragmented. Patient, same thing. How much somebody said, who said the other day, they don't even know what the bill looks like and what access to the information they have in a hospital system, right? So the doctor says something and you go through the procedures. Right now, my pacemaker is linked to a hospital system. And if something goes wrong with my pacemaker, there's a signal that comes. That's the only signal I'm getting right now because I travel a lot, is saying, oh, your phone app is not communicating to us. So I got to stop, make sure I reload that app, and then it says active. I'm doing well. So I'm trusting that when it says active. But beyond that, when something happens to me and I feel tired, I don't know whether it's because of my pacemaker that's happening it or something else. So information transparency is not. So what does it do? It paces your heartbeat. So I have to now, as a smart person, look at my Fitbits to see what's happening. It's supposed to regulate the blood pressure. I got to use my blood pressure monitor to make sure that my blood pressure is not shooting up or down. So the integration is where I'm going. I'm not complaining. I'm happy. But I'm saying the integration as a patient. Payers, a lot to do with what do you do with falsified medical records and things of that kind. Auditing and data provenance is very important. A lot of blockchain gets into this area. Research organizations, again, unavailability of data. US is now going through a struggle with healthcare funding for research. Projects are prioritized. Some projects are put on back burner. Others have come in the front. So all this has importance for research organizations. Logistics inefficiencies for pharma supply chains, incorrect inventory management, all those challenges that they face. So now that we know that some of the challenges, what are some of the strategic actions that stakeholders can take? Anything I can do with prevention and early identification is critical. So that's one thing. Anything to do with prevention of shortages. How do I do prevention of shortages? Make sure my data is aligned in multiple ways. I look at it. Make sure data accuracy improves. I said in one of the classes about buying yogurt and swiping it and how you can deduce what's happening to what I purchased, what has been reduced, 2 different ways. So all those type of data accuracy issues you need to look at. Containment and countermeasures. These are happening at the national level. How do you look at the piling of common goods and how do you use that information in inventory? Medication rollout capacity. During COVID, we saw this a lot. Community hospitals versus do you send them, as Professor said yesterday, where do you locate? Which hospital covers who? All those kind of details are important.
Does the term double down mean? Second line.
Double down, which means pay more attention towards the global early warning systems. When WHO was putting out these data on how the spread is happening, countries looked at it very differently. The early warning. Some countries took it seriously. The lockdown started much earlier. Some waited a little longer. So the doubling down is the countries that took it more seriously and put more extra measures. So over the period when you look at death rates and things like that, even within a country, not don't go comparing countries, just within a country, you saw this differently. Migration patterns and things of that, and increased kind of COVID. So that's what we are talking about, the warning systems that were put out at the government level. And warning systems sometimes did not come from the government level alone. It was field workers that were talking about, that they see more propagation of this, some counties. And that information to travel, to convert to actionable item took time. So the early warning did not come only from top down, it went from bottom up too. Field workers, healthcare workers. We had some good stories, right? So during COVID, when this slide talks about how many facilities and how many doses of vaccines, billions of doses of vaccines reached people. And so, a lot of things were going right, actually, from electronics and other standpoint. This is just DHL. One of the emerging trends that are happening in healthcare today is what's the role of AI? And I think on Thursday, I will talk more details about this in specific, so I will not go into the details today. But to help you with transforming this inventory for patient-centered care, real-time visibility, and predictive analytics, all of those things are happening because of machine learning, robotics and automation, the IoT of things, virtual centralization. So you don't have to physically centralize goods. You can virtually centralize through information and help that understand. Of course, vendor-managed inventory is one of the things. Digital supply chain management in healthcare industry, this is getting a lot more attention today, because the more you digitize, the better it would be to gather the data. And the cost of digitization is not what it was 10 years ago. The cloud-based platforms today offer you a lot more options to digitize. And so as you are digitizing, one of the things that I always tell people who try to digitize a process is, please don't digitize a bad process. So first step is look at your process and see what you can do to the process to make it better before you digitize the process. Otherwise, there's this famous word called paving the cow paths, which means the path through which a cow travels, you're trying to automate that path. But that may not be the right path. I mean, Professor talked about so much about optimization and routing and assignment. Before you solve a problem like that, you don't want to automate that particular aspect of it. So it's important to understand better processes. It's more of the same. I'm not going to spend too much time on this. We'll talk more about data analytics in my next talk. Blockchains. How many of you have heard the word blockchain? Okay, somebody raise their hand. Tell me what's your understanding of blockchain?
So, letting the data, maybe that no one can attack it.
How does centralizing make no one can attack? Tell me, I'm not. Did he say decentralized or centralized? He said centralized. Hold on, I've got an option to argue with him. Let me argue with. I'll come to you, Rachel. Yeah. It's okay. Keep talking.
Can steal the data.
No one can steal the data by centralizing it?
Yeah.
Come on, boss. I can steal it if you centralize it better. No, you have to only hack one server then.
No, it can't be hacked.
Why?
Because it is more security than other practices happening in.
How does it get more secret?
Not much idea about it, sir.
Okay. Now, let's go to here. All the issues are correct. Let's get back to it. Why do we have to decentralize?
So,
Because it's some point. Yeah.
When we decentralize it, hackers can't. We'll have information at different nodes, sir. So the data can't be attacked if we store it in different nodes. If it is centralized, the hacker can hack it at a single point. So that is the problem with the security point of having a centralized information storage. So here in blockchain, when we decentralize it, the information can be stored at different nodes which can't be attacked. So
Fazar, what do you think about blockchain? Sujan, or
Blockchain.
get a mic, please.
So every business entity has right now managing their data in ledgers. They have their own ledgers, correct? So they update each process, whatever activity they do. In business environment, when they produce something, they sell it to the next entity, okay? So the product goes there, right? And they have their ledger. Next entity will have their own ledger when they receive and this thing, But the next entity, when receiving that, how would you ensure the product is not a counterfeit kind of thing? Let's take context of drugs, okay? Whether the product is defect-free, the information which supplier is sharing with you, how we can say that it is authentic, right? So it's a decentralized system, okay, where it's a digital ledger, you can say, but most important thing is once you maintain that digital ledger, it's a kind of entity, or it's a kind of you enter something and then next entity in the whole supply chain, or you can say the conglomerate of, the entities in the blockchain, they can also see that data, but you cannot edit the data. Okay. So you would enter and that would be attached to the previous one. This is how you will create a block, right? So this is that's why, the blockchain, you say, this is this. So this is how it's a decentralized, everyone is entering, they can enter, edit, not edit. Once it is entered, it is not editable. Okay. So now what is the benefit? How it is decentralized? You can view, but you have to be partner. There are different configurations of blockchain. Okay. So whether you can access as a conglomerate or, the part of that, blockchain, then you can access. Okay. And whatever information you would put or upload, that would connect to the previous thing, but it is not editable. Suppose if you want to edit, it would be created as a next block. You can link it with the address of the previous block, but you cannot edit the previous block. This is how, so now why it is immutable, they say. Okay, that's why this is immutable. Okay, and what else we have heard of blockchain properties? Decentralized means everybody in the supply chain has a control on what they want to edit and sell. Okay, so it's a decentralized, correct? And at the same time, the entities can view that. Okay, so what other properties we have seen? Immutable, yeah. Secure. How it is secured? Because you cannot edit. Okay, so you cannot edit all the supply chain entities across whatever they are, Now, how it is safe and secure, I'll quickly give example in the context of supply chain, Suppose, I'm not sure, let's say pharmaceutical, what process they are following, right? I may ask supplier, when you are doing this process, can you add video of that? Video will be having time stamping, everything and all, right? So as a manufacturer or the next entity, or as a next entity, maybe the auditor, I can see the file with the time stamping that, okay, this is done, which is not editable. I can be little sure of that the genuinity of, the product. Basically in supply chain, it is used for tracing back the supply chain, right? I can trace back in a reliable, safe environment immutable environment, like, the tracing, the security, safety, all these aspects are possible in the blockchain, right?
2007, sir, it was started with the what Bitcoin. It was quite famous at the time, Bitcoin. So in Bitcoin, blockchain was mainly introduced. A chain because it's a chain of block, and it came with miner means each a miner means each a like every person as a miner. If someone wants to edit the data or information that is put in a block, so after editing or putting permission on that data, everyone should have to approve. Otherwise, it cannot be edited or it cannot be updated. That's why it's a secure system or immutable system. If someone denied, no, this data cannot be edited, so that block cannot be edited by the others also.
Yes, sir.
So just to conclude, it is decentralized. What's that? No. Maybe the part about blockchain is it is giving a governance more to you. Because if something is very centralized, then your governance is limited. As an individual working with it, you always have to go somewhere else to get. It is kind of decentralizing, giving that increased governance control to you. But at the same time, the provenance, which means traceability. When look at this diagram and look at the brown at the end, where it talks about order received and processed, shipment prepared. These are activities that go on every day within an organization and across organizations. What happens, I have worked in these areas a long time back. Either it was manual, right? You finish something and you have to, which is easily, somebody can lose it or somebody can manipulate it at the next level. And so now imagine each of these have started becoming individual blocks that only the next person has the control. That control can kick it back to the previous level if they are not happy, but they cannot change it. So who has the best one in an administrative sense? Adobe. Today in many places, as a faculty dean, I don't even receive anything that is paper. It goes through a blockchain that Adobe has, where the person before me finished this task and verifies it, and then comes to the next level and finally comes to my signature. I can trace and see the entire chain of what has happened, but I cannot change anything. If I have to change, I have to instigate another block to move backwards. So the security of that flow, if that is important, has happened. That's why they call that immutable. I cannot mute anything and send it. So imagine now you are sitting in different part of the world where starting a bank account is difficult. But you are producing a product and selling it to the next level. How do you keep provenance of that, and so that you could go to a bank to cash something? Blockchain is used in Africa in some of the villages where people can start a bank account. Some social blockchains have happened. Those are not for-profit blockchains. These are social entrepreneurs that have developed blockchains. So this technology, if properly used, need not become a cumbersome one, but become one to keep the provenance going, security improved. But what's any of these will have its drawbacks. One of the drawbacks is it's a little bit costly to implement it. It's not cheap. And the more people are involved in blocks, the more computing power is needed, because the immutability and the security is because of advanced algorithms that develops code that allows you cannot break into it, which means the computer is spending more time and power and energy to do it. Constantly, it's coming down in cost, but still it is expensive. So those are some things to know about blockchain. Some of the research aspects in healthcare supply chain management today, people are talking about patient waiting time post-COVID. because things have come back to normalcy. So what's happening in your particular areas in terms of the patient waiting time post-COVID is critical. Service ecosystem, which is the risk and resilience of healthcare supply chain management, another big topic to think about. Technological revolution and digital twin. Anybody heard the word digital twin? I heard somebody say digital twin. Why don't you explain what your understanding of digital twin is? This is what happens. If you talk to me one-on-one, then I'll call you. Say things.
A digital twin is like making, like in our case, there is a building, making a copy of that building in a software where you can make changes for that building and simulate it, which we can see the changes, what can happen, that we can replicate in the real life also. Like physical form is there, this is the virtual form. We can change in this, we can simulate that. We can see what are the changes we can do to make it more, change the orientation or change the facades or anything that can change the temperature, inner temperatures, or change any other consumption or energy consumptions like that.
So there are a lot of tools, right, to doing that. What we call as computer-aided design or computer-aided softwares. Why do you want to call it digital twin? What makes it a twin? I understand the concept. The concept is a replica, a digital replica of something. Could be a building, could be a system that you want to manipulate with a computer without actually manipulating the physical entity and provide some what-ifs. That's, am I saying it?
Yes, sir.
Why do we call it a twin? Simply?
Similarity.
Similarities, okay. But that's why I'm saying we've always had, computer software for doing it. Simulation is nothing new. The one difference, if you want a true twin, is real-time data. Real-time data feeds into your model. A true digital twin becomes alive if real-time data. So buildings, as it is performing that day, if it has IoTs, if it has other things, that data is feeding into your model, the digital model. That's the digital twin in true sense. And you can sit down. Thank you. You said it all right. I'm just clarifying the aspect of the twin. Why? Because that's something we could do today with computer systems. Is you can simulate in real time what's happening somewhere else and manipulate. I'll give you a quick example before we move on to the next one. So in cancer research, cancer treatments, if you think about it, how it happens is a new drug comes in. It could be a cocktail, whatever it is. Pharma develops it for a particular type of cancer, let's say. So what happens? It goes through a clinical trial. As it goes through a clinical trial, data is collected. So the traditional way is the data is collected after the clinical trial. What does the clinical trial say? Under what condition this works? What kind of reaction the patients saw with this? How long, if it's an infusion going one way versus orally? So different kind of infusions can happen for cancer depending on the type of cancer it is. So all this clinical trial is happening. That data is available. It goes back to the pharma people. They fine-tune the drug. And then finally the drug comes to the hospital systems. And every time a new drug comes into a hospital system, hospitals go through a process which I call chaotic assignment of patient to those drugs, because that's an uncertain process. If a new drug is infused on a patient, on a population of patients, what is going to happen is uncertain, in spite of all the data that has happened. So what happens is, you think it's going to take a 1 hour infusion for a patient. Because of reactions the patient has, it may take 8 hours. So these are specialized beds in which the patient sits and does this. So it's not like any chair that you can pull and say, you sit here, I'm going to do a chemotherapy on you. These are specific type of systems. So they are limited. They have to be managed by 2 or 3 nurses who are qualified to do that. So all these resource implications happen. Real time it happens after the drug is given and as it happens. So what we did was we developed a digital twin. A digital twin here is as the two parts to it. One, as the federal authorities are collecting data on clinical trials, we fed those clinical trial data into our model. We were able to get it and feed it. Now, when the actual patients were going through, we were able to feed that data into our model. By doing the simulation now in real time, after a few patients, we were able to tell, based on AI, how the drugs will react in the future. And use this information to manage the nurse scheduling, the chair time as they call, and the drug needs. How much inventory of this drug do you have to have in order to infusion? Sometimes you think it is, just to pick a number, 3 vials of a drug. It may be 2, it may be 7 before the chemo is over. So the uncertainties in a system, how can you study and simulate? The digital twin becomes a way. The only difference is real-time data. As things happen, can the data come in? And can you use it in your model to keep on fine-tuning or predicting? One of the two. So otherwise, spot on what you said. All right, so yeah, I think it's a good point to
Yes.